All right, guys, I'm in. Jamie,
I'm in, but it won't share my video.
It won't share your video.
No, it's got an X on the camera.
Well, it has an X on the sharing screen for me, so that's all you, I guess.
And see, I'm sharing. It says go to application window. I've got the PowerPoint open.
Maybe I can invite you to video call. Let's see. I sent you an invitation. This is definitely not like Zoom where you can give yourself a background. It says that we have 6 people, 2 out of the 5 people who are going to be on here.
I don't know how to get this into the, so Tony's here now. I can't get into the, where it's sharing my screen. It's not in the presentation mode.
Go to stage. I think you have to go to stage.
Okay.
On your left-hand corner.
Okay.
And then it should, let me open up her screenshot again. So then you can go to the applications window. Oh, well, she has 2. So you can go down at the bottom to share screen. Hold on, let me see. So do you have a red X on it? Am I talking to anybody? Uh-oh. Click twice, maximize video. What does that mean? Okay. Okay, Jamie, you're back.
Yeah, it goes, when I go to stage, it'll ask me to leave.
Okay, so don't leave. I think you need to click twice where it has the red X on your video. Click twice on it because that's what I had to do.
No, there's just, there's still an X.
Okay. It says click twice to maximize video. I don't know how I'm gonna keep this all quiet. Laptop.
And now it's saying all your video devices appear to be unavailable.
Okay. All right, go to your settings. Go to the settings square box. And it has your default microphone and your integrated webcam.
Yeah, it says it's unavailable.
Did you log out of the Teams call too? Yeah. Like completely out?
Yep.
Ooh, I don't know what's happening. Is it allowing you to at least share your screen?
It's allowing me to share my screen, but it's not.
Because I don't see your screen.
There's my screen. Can you see that?
Yep, I can see that.
But see, when I do slideshow, like I can't see y'all speaking. Like it's just my window.
It's about to be very interesting.
Like, can you see that?
Yeah, I can see that.
I guess I'll just have to stick on this and talk through it because I don't know how to get my camera on. Like I've never had an issue with my camera.
Yeah, I'm definitely.
I've got it on my work computer too, so I'll be able to see what y'all are doing.
Okay, good. You know what? I'm gonna put this slide over here.
Tony's still not in here.
Yes, he called you?
Yeah, I was in the whole time. Hey. You have to go in and click share audio and video. Are you logged into the thing? Did you go to the left and hit sessions and go down to the very bottom and hit our session?
All right. Hi, guys. Sorry. It was hard to find it. Did everybody make their way into the space?
No, Tony's
No.
having issues right now.
Yeah. Yeah. Can he not find the session?
No, and I can't use my camera.
Let me see what I think I searched for it. I went back into emerging leaders. I searched for emerging leaders, and then I searched for Tony is in the chat. We can't hear you, and we don't see you. Maybe you need to share your audio and your video. Oh,
It's not giving him the option to share audio and video.
okay. So close out and come back in.
You hear Tony?
Yeah.
Okay.
Okay, let's do that. We have time. It's okay. It's fine.
And like I said, I can't get into my, for some reason, my webcam isn't working.
Okay, I'm back in, but it's still not.
So sometimes when I join different forums, it's going to shift camera. So for example, if I do a Microsoft team, it's using a different camera. If you have multiple screens and multiple cameras, or not multiple cameras, sorry. Well, maybe if you have like a laptop and you have a camera on the laptop and then you have like a separate camera, a webcam, sorry.
It's still not going.
Still not doing anything for you? So are you on Jamie's phone?
Yeah, I called.
Okay, so I wonder if I can hear you slightly. I don't know if you can put him on speaker, Jamie.
Yeah, he's on speaker.
Oh, he is on speaker? Okay, and raise the volume maybe? I don't know. This is where I'm trying to be techie and I'm not. I know Pamela is in the room, I think. Pamela, do you have any idea what we need to do to troubleshoot? All right. Betty and Jamie, are you able to cover for Tony in case we can't hear him?
I am not. No, we all kind of have our own areas.
Yeah, I totally understand that. Yeah. All right. I don't know if you need to. Did you completely close out of the NCPAJ conference, Tony, and
Yeah,
re-come?
so I'm going to do it one more time.
Okay. Did you say that you're going to do it one more time? Oh, Pam. So Tony can't get into. He can't get into the session. So we're missing one presenter, and he's not able to get into the session. And Jamie and Betty, was it because he wasn't able to find it, or did he not just?
It's like when he's entering the session, it's not giving him the option to present. It's just sending him to watch it.
Right. So he's in the session, but he's not set up to present.
Yeah, bounce back in and it's going to.
So you're not registered as a speaker, it seems like. Maybe is that Pam? Is that the issue? Maybe do you think?
I registered.
Yeah. No. Yeah. I'm sure you've done it right. Yeah. Okay. She's calling Kim. So we're just gonna. This is what happens in technicals in virtual forums. I think everybody's is fine with it and everybody's patient, and we thank you for that. And we're all used to this, right? So who hasn't had a virtual forum when something glitched and there was a camera that didn't work, or the audio that didn't project, or the screen or the PowerPoint that didn't project, or something. So I think at this point we have a fairly high level of tolerance for anything that can kind of like.
You possibly put me close enough to your speaker.
Okay, you're right up on it.
Is it making an echo?
Yep.
Okay, I'm sorry.
We can hear you though, so that could be the solution, unless Pam and Kim are able to solve this. So let's give it another minute, and
Okay, we just roll with it that way if you want.
This is interesting because I'm the one who always loses internet. So for the fact that I was able to get my screen on and Tony and Jamie, we're switching roles.
Yeah. Which is great. That's when you kind of like understand how it is to sit in that seat, right? When it's not kind of like, you know, working for you.
Yeah.
So Jamie, your screen share works. We got your slides. So that's perfect. And we just need to get Tony in as well. And Betty, I love your painting in the back.
Well, thank you. Thank you. I usually, for these kind of setups, I usually blur it out, but I realize Hopin doesn't have that feature like Zoom. So
no, I love it.
Thank you.
I think it's beautiful. Love it. Tony, if you can see, Pam just posted in the chat box that Kim just added you. So you should be able to do log out and log back in. And go back in as a speaker, and then we should be able to have you. And this is why we build in some time cushion, so we're fine. So we're good.
Okay.
Yeah. So
well, we actually thought we were originally supposed to present at 10:15, and we were like,
yeah. Well, I'm sorry if I misled you a little bit.
It's okay.
Tony is okay. So hit refresh. Pam is just asking you to hit refresh.
Okay, here we go. Got it.
I am. Oh, here he is. Fantastic. Awesome. All right.
I apologize, y'all. Sorry.
No. That's not your fault at all. And we're learning. So this is a great learning moment for everybody. So it's absolutely fine. And it's what happens today, right? In the space of virtual meetings. So we're good. But let us kick off. So welcome back to all of those who've been with us from for the past two projects presentations. For those of you who are joining us for the first time, this is the Emerging Leaders in Public Health Leadership Development Program, and this is the culmination of the program where the groups present their project that they have been working on for the course of the program. The program lasts a year, and as of course I mentioned in the prior session, as everybody, we were hit, in the midst of the project work. These groups were hit with the pandemic, obviously, and they've managed to do some amazing work regardless of that. So that just shows the tenacity of these people and this group and what they can do. And I'm telling you, all of the people in this program, all of the participants can move mountains. These are change leaders for sure. Without any further ado, I want to hand it over to the next group. They are going to talk about, the title of the project is Maintaining a Harm Reduction Program During a Pandemic. So very current. And we will hear from Petty Foe from the Cabarrus Health Alliance, Jamie Todd from Cleveland County Health Department, and Tony Locklear from Hope County Health Department. So over to you.
Okay. Thank you, Tina, for that great introduction. We are excited to be here today. I have had a great experience with such wonderful teammates who are subject experts in this field and really opened my eyes to what harm reduction actually is. We did shift gear in response to the COVID epidemic because we thought that was more relevant, and we were also coming from three different backgrounds, 3 different counties that are operated differently. So we'll jump right into the presentation. Go ahead, hit the next slide. So in relation to the history of harm reduction began in the 1980s, an alternative policy to war on drugs. According to the International Harm Reduction Association, harm reduction refers to policies, programs, and practices that aim to reduce the harms associated with the use of psychoactive drugs in people unable or unwilling to stop. The defining features are the focus on the prevention of harm rather than on the prevention of drug use itself, and the focus on people who continue to use drugs. Harm reduction programs engage people at different stages of drug use to help protect themselves and their communities through safer behaviors, relationship building, and connections to care. Harm reduction programs meet people where they are at in their drug use and aim to reduce the negative consequences associated with that use. The harm reduction approach to drugs is based on a strong commitment to public health and human rights. HIV was the catalyst for the initiative and general adoption of the harm reduction approach. The global war on drugs is driving up the HIV pandemic among people who were drug users and their sexual partners. Throughout the world, research has consistently shown that the repressive drug law enforcement practices force drug users away from public health services and into hidden environments where HIV risk becomes markedly elevated. We are each going to jump in individually about our respective counties, and then we're going to bring you guys back together and to discuss some of the rates that we are experiencing with our respective counties, and also some of the changes that we had to implement during COVID. To give you a little bit of a background about Cabarrus Health Alliance, I am the Quality Improvement and Accreditation Manager there. I didn't introduce myself earlier. And so we are located in Cabarrus County, which is neighbors to Mecklenburg County, Stanley, Rowan, and Union counties. And in recent years, were really popular due to the Great Wolf Lodge, Concord Mill. So if ever you are driving by a whole bunch of construction, that's where we're located. We refer to ourselves as CHA. CHA is a public health authority created by Cabarrus County Board of Commissioners in 1997. As the first county health department in North Carolina to serve as an autonomous entity, Cabarrus Health Alliance has proven that a bold and innovative approach to public health can have an effective force in improving community health outcomes and in the provision of essential services. Like other healthcare providers, CHA faces many of the same challenges, including regulatory changes and restrictions, financial restraints, and increasing demands for services by the patients and clients we serve. In addition to these challenges, CHA must deal with a potentially volatile political climate, an increasing uninsured population, emerging public health trends, and are drastically impacted by social determinants of health. Our mission is to achieve the highest level of individual and community health through collaborative action. So we're responsible essentially for all traditional public health services, and through a unique structure as a public health authority, we're able to have more flexibility with decision-making and grants. We're able to embark on some really amazing projects and acquire grants that complement work being done in our community and that align with the community needs assessment. So as we're transitioning into the session, we're also going to discuss how each county operates differently. So here you see a timeline of how our harm reduction program actually started. It was identified in the needs assessment as a priority area in 2016. I'm not going to read the full timeline because you can see what significant steps happened in order to ensure that. In January 2018, Cabarrus County dropped out of the 10 counties for overdose in the state, but we rose to number 4 the next month. So we have just been reiterating how this is a priority need. Although recent community needs assessment did not identify substance use as a priority need, we are still operating with this program, and we are operating within our health agency, our health department. I will go ahead and hand over to Tony.
Jamie.
Yeah, I think I'm next. Sorry. That's fine. So just quickly, overview of Cleveland County's harm reduction services. And it's going to be similar to how Tony's county experienced how harm reduction was established. Basically in 2018, a need arose for harm reduction services, and particularly a syringe exchange program. So the health department applied for and was awarded the emergency overdose local mitigation to the opioid crisis for local health departments and districts grant. So that grant was designed to establish and strengthen harm reduction activities in Cleveland County by implementing improved strategies such as establishing a syringe exchange program and connecting justice-involved people to get treatment and harm reduction resources. Points of Hope was created. Points of Hope stands for Halting Overdose Through Prevention and Education, which aims to get participants access to treatment and other resources with a whole person approach. In addition, Olive Branch implemented harm reduction training with jail inmates, educating program participants about risk for overdose after release and Narcan administration and availability. Inmates signed consent to be contacted by peer support specialists to do case management, connection to treatment, and syringe exchange. Since then, we were awarded the COAP grant as well, which is just basically sustaining this syringe exchange program in Cleveland County.
Okay, just as Jamie said, Hope County pretty much began its action to address opioids through our Hope and Hope Alliance that was formed, and it included individuals from recovery, local hospitals, law enforcement, mental health, schools, churches, and other community organizations. And they met monthly for some time to develop community capacity to address the opioid poisoning and overdose issues that we've seen within the county. That happened in April 2017. In 2018, we were awarded the same funding that Cleveland County was awarded. We was able to begin the groundwork to establish a syringe exchange program. That syringe exchange program actually come into place in 2019. We started servicing in conjunction with Tia Hart Community Recovery, a local community-based organization that provides recovery support, peer support specialists, services, and NA and AA meetings. In 2020, we were awarded additional funding. We moved our fixed site into a mobile site as well, so we're now doing mobile and fixed site syringe services, but we also wrote into that grant opportunity to establish the post-overdose response team. So that's what we're working on currently, is to establish our port team here within the county. And one of the unique things about Hope County that we found is a barrier is a lot of the individuals in the county may access hospitals outside of our county, which is even in some other regions. So they may access Robeson County, Moore County, Cumberland County, and Scotland County, which creates issues with us when we're trying to demonstrate a statement of need and get truly accurate numbers. So we noted our numbers related to opioid overdose and poisoning oftentimes is skewed. So that's one of the barriers that we have here in Hope County.
So moving into substance use during COVID-19, substance use is up across the nation. Since the shutdown associated with the COVID-19 pandemic, which is putting an even greater strain on local harm reduction services and emergency departments. So in this table, you can see the opioid overdose emergency department visit rates were above the state average across all three of our counties during the month of May. Also, you'll notice that Cleveland County was particularly hit hard by an increase in opioid overdose post-COVID shutdown. And you can see the numbers there. Cleveland County experienced rates of opioid overdose ED visits that were nearly double the state average during the months of May and June. And we've continued to see above state average rates since COVID started. Additionally, Cleveland County Emergency Medical Services have also seen a drastic increase in calls for service related to opioid overdose. So again, as you can see in these slides, the responses were actually trending down during January and February pre-COVID. And then once the shutdown occurred in March, those numbers began to skyrocket. And they are continuing to see, again, increases in overdose responses and Narcan administrations. So some of the factors associated with the opioid overdose spike across all three counties, isolation is a big one. We all know that boredom is a really big trigger when you're talking about substance use and relapsing and just use in general. Depression associated with COVID-19 and anxiety. Substance use counseling is limited. A lot of counties went more towards a virtual counseling option. Where a lot of participants really just, they don't feel comfortable doing it virtually, like they want to come in continue their normal routine, see people, talk to people. Then unemployment was obviously a big issue. More locally, we did find out the stimulus payments made it easier for users to fund their habits. So all of a sudden, people had $1,200 laying around, and unfortunately, I know in Cleveland County, a lot of that money went towards the purchase of narcotics. Fentanyl and counterfeit pills are causing a lot of the overdoses here. I know in our county and across the state, we are seeing an increase in cigarette smoking and tobacco use. And then more people are seeking out and using sedatives, alcohol, and reports of increased IV heroin use. So I'm going to pass on to Tony, where he's going to kind of explain how harm reduction efforts have been affected by the pandemic.
Just like everything within the public health realm, due to the pandemic, a lot of our harm reduction efforts changed and was identified through our survey within our 3 counties. Immediate adjustments were initiated to protect staff as well as participants. And strategies were extended to include appropriate COVID-19 harm reduction within the counties. And a special emphasis has been placed on the importance of proper hand and drug hygiene practices. It's not just about using drugs, but it's about, cleaning the surfaces where those syringes are going to be laying and those type of drug hygiene practices, as well as the 3 W's. A lot of the recovery and peer support services went from being in person to virtual sessions. And we have seen that mobile syringe exchange did increase. Here in Hope County, it is still a fixed site, but we've encouraged more of the mobile syringe. And here in Hope County as well, we've seen more of an influx from the surrounding counties accessing syringes right now. So we don't know if it's due to the availability of drugs being tougher to get and people's crossing county borders or what. But efforts have switched as well with the virtual naloxone administration training too. Next slide, Jamie. In relation to health equity, stigma, discrimination, health messaging, and accessibility are all compounding factors for increased substance use. People who use drugs are commonly discriminated against and are particularly at risk of not being able to access and or receive the same quality health care as others in the community. And we know that stigma plays a huge part in that discrimination within the community as well as within the service providers. Efforts to reduce misunderstanding and improve knowledge is key. Oftentimes our substance users have a low health literacy, and many people who use drugs may not fully comprehend the health messages that's being disseminated. Therefore, it's crucial for clear health information to have messages, diagrams, and as many infographics as possible for individuals to be able to understand. And it's also important to take extra time for service providers to make sure and assure themselves that the target population fully understands the safety messages, measures related to public health messaging and recommendations. Next slide, Jamie. Within our key informant feedback, each group member enlisted their individual county coalitions, which consisted of stakeholders who work in the scope of harm reduction. We were able to collect 17 survey responses via SurveyMonkey that was conducted online, and we had a range of individuals from clinicians, behavioral health practitioners, law enforcement, public health professionals, individuals in long-term recovery, peer support specialists, and even volunteers. The stakeholder analysis asked specific questions which described how each county operates, and especially how they're operating under the current COVID-19 climate. And as you can see on here, some of the identified roles, this is some of the things that we've seen within the box that you can look over. A lot of the roles is especially coordination of care and taking that care coordination beyond just providing the syringe services, but also trying to meet the needs of the social determinants of health. Also engaging youth, the importance of the port training and all of that, as well as social media awareness, and especially having an emphasis on social media awareness, tackling that health equity issue related to stigma.
Okay. So in the midst of the pandemic, it's essential to consider the needs of the people who use drugs. The most accurate and up-to-date information to help active users plan for what to do, stay healthy, and minimize the risk of novel infection is vital. Of equal importance is for a continuity of harm reduction supplies to be available. Social distancing measures, curfews, and decrease in transportation options has resulted in difficulty for many individuals in active use to find supply in a safe way to use. Public health messaging should be also considered. Tony just mentioned health equity, and within that we are covering social determinants of health. So all those aspects need to be considered. Emphasis should be made on washing and sanitizing hands, supplies, and surfaces with some form of disinfectant. Messaging consideration has to also include populations who are vulnerable and underserved and at risk, who live in shelters that are involved within sex work. Next slide, please. Allocation of funds is very essential. Shelter-in-place orders impact the way harm reduction programs and providers can support participants and gather people together. Logistical challenges create the need for developed emergency and communication plans to ensure that service disruption is at minimal and essential services do not become affected due to absenteeism. Illness and burnout by staff and volunteers also need to be considered. People who use drugs are among those facing additional risk during COVID-19 pandemic, and harm reduction supplies and services are essential. Therefore, funding investments for harm reduction supplies and services could be used to support virtual capability for training, one-on-one sessions, staffing expenses related to additional travel, outreach, and capability to operate under untraditional circumstances, and also untraditional hours. Sustaining and expanding supplies, increasing testing capabilities, food boxes should also be considered. Support is needed drastically to help provide survey and assessment to understand how the pandemic impacts programming and what efforts are needed to help programs recover and adapt. Next slide, please. In relation to a collaborative effort, many collaborative partners experience shortages and closures due to COVID-19. We need to advocate for community funding for harm reduction services, and those funds must be sustained throughout pandemics to prevent overdoses and increases in communicable disease transmission. One thing that we definitely realize is that during our preparedness planning, all programs and agencies should be considered how they would actually function. And I think harm reduction was one of the least considered. This should also include the affordability for harm reduction programming staff and participants that have access to adequate PPE. Next slide. This actually concludes our final, our presentation. If anybody has any questions, I believe Tony or Jamie, one of them was monitoring the chats, or you can go ahead and ask questions now. Next slide.
Thank you so much to this group. And I think there is a comment from Pamela about how important it is to look at see all the statistics you're posting and the significant repercussions for communities and harm reduction efforts. So thank you so much for this project work and for all the efforts you put in there. This is important. It is, I think, another one of those that really has come to the surface during the pandemic, how important it is that we fund and keep working on. And I love how you have approached it from we need to meet all the individuals that are affected and where they are. Unfortunately, we're going to have to move on. We're a little behind on schedule, but I do want to encourage everybody to look at the project write-up of this group as well. There's a lot of information and details in there. And also I would encourage anyone who wants to learn more about how you would start something like this, or how you would continue or improve or collaborate, to get in touch with any of the presenters in this group as well. So thank you so much again. I can't tell you all your hard work, how wonderful it is and how great it is. And I can't wait to see what you're all going to do in action out there to move public health further. Thank you. And I hope to see everybody in the next session, which is going to be about safe sleep and infant mortality and how it links to safe sleep in rural Eastern North Carolina. So hopefully I will see everybody in there as well. Thank you to this group.
Thank you.
Bye, everybody. Thank you.
Solely on a pack and play, it would be 1 and under just for safety measures. Parents are asked what their child's current sleep environment is, or what their planned sleep environment is if they're currently expecting. If the child's environment is not safe, then we'll educate them on what a safe sleep environment is, and then they will receive a pack and play with educational material as well. So our project team developed a questionnaire, just something that was extremely simple. A lot of you work in health departments and know that patients are not looking forward to filling out a long, extensive survey. So just something really brief so we could capture it and they would be interested in completing it. This is used by our maternal health nurses, child health nurses, our providers, OBCN, CC4C nurses, and social workers to determine if expecting mothers or infants are eligible for this program. This is what the education material and pack and play kind of look like as a package. As you can see, it includes a pack and play, a Halo safe sleep sack, a crib cover, mattress cover, and then some information on safe sleep, and then a children's book that still kind of relates to safe sleep. And how did we reach participants? As a 3-county district health department, we work as a team. Any employee who encounters a prenatal or child health patient is aware of the program and goes over the current or planned sleep environment. Staff would include that would be involved in this would be WIC clerks, nutritionists, clinic nurses, OBCM nurses, CC4C social workers, etc. And then as far as educating the patient, we also, with COVID, we intended on doing classes and kind of having a sit-down discussion and going over things like this, but of course we couldn't do any of that. So we did really good. This was actually included on the questionnaire, just kind of going over the basics, making sure that they know to lay their baby on his or her back to reduce the risk of SIDS. We know that stuffed animals, bumpers, and all those cute accessories make a baby's crib seem warm and cozy. Unfortunately, they can often do more harm than good. Soft bedding can block a baby's airway. During sleep, a firm mattress covered with a tight-fitting crib sheet is all you need to make your baby sleep like a baby. If you're worried about keeping your baby warm on those cold nights, our package actually included this sleep sack that they're talking about, and they actually go from sizes of newborn up until, I've known 3 or 4-year-olds that use them instead of a blanket, so that it's zipped and their arms are hanging out and there's no way it could possibly cover their face. And then, little things like this that I think a lot of people are hands-on. If you can fit a soda can between the slats of the crib, that means your child's head, hand, or foot could get stuck. That's just kind of a good way to judge. Make sure the mattress is firm and fits snugly. Otherwise, a child could get stuck between the gaps. Cover it with a crib sheet with nothing else, just a crib sheet. Babies should not sleep on beds, sofas, recliners, chairs, soft surfaces, bouncy chairs, or baby swings. This happens, make sure to return the baby to the safe sleep environment, such as the pack and play. And then we also tell all new parents they definitely should take CPR. And so who funds this program? We are extremely grateful for this. Prior to the Emerging Leaders in Public Health program, Martin Terrell Washington District Health Department received the Ann Wolf mini grant to explore ways to educate mothers on the importance of safe sleep. So our project team consisted of representatives from Martin, Terrell, and Washington counties in Transylvania County. So there was an opportunity to leverage the work of Transylvania County to this project to explore sleep-related deaths in Transylvania County. We also used our, every health department has a child fatalities team that serves every county, so even Transylvania, Martin, Terrell, and Washington. I serve on the one here in Washington County. We review child deaths up until their 21st birthday. So, I mean, obviously, reviewing child deaths, we see a lot of things that would affect safe sleep, could have affected it. They could still be alive. So we also could incorporate Transylvania County in that project as well. Heather is one of their pregnancy care managers there. And that is all I have. Safe sleep in children is truly a passion of mine. So I'm excited to continue this program here in our health department. And it was nice to kind of tie it with another county as well with our 3 counties.
Thank you so much, Nicole, for that presentation. And we do have time, so that is wonderful. And I want to invite anyone in the audience if you have a question. And as we monitor that, thank you again for the work that you and Heather and Kirsten together did for this project. It's another one of those really important topics that we need to keep focus on. In your project write-up, and again to the audience, we posted the link to the project write-ups in the chat box. But in your project write-up, you actually, the infant mortality in Terrell County was 0%, if I'm not mistaken.
That's correct.
What do you think is the difference? What happens in Terrell County that impacts that number?
Unfortunately, I can't say that they're truly educated on safe sleep, and that's why they're rated 0%. I think it's just because it's a small county and there probably is not a lot of births in that county, whereas Martin and Washington County are our bigger areas. I was still shocked to see that it was 0%. And the Terrell County child fatality team, I don't serve on that, but I do know they don't get a lot of deaths, especially for 21 and under for their child fatality team. So that's definitely a good thing. They may have one every other year, something like that, whereas Washington and Martin County have them pretty often. But I was very shocked. I really was.
So would you think that that has anything to do, you're mentioning the socioeconomic factors, is that something that might impact, or do you think what would your, just based on your experience, you have a lot of experience with this and you're working in the midst of it, you're passionate about it. What are your thoughts when you look at what the differences are between those counties?
I mean, it helps us that Terrell County is so small, so maybe we are able to educate those mothers that are there, whereas Martin and Washington counties, there's multiple different pediatric practices, not just us in Terrell County. It's either the medical center or the health department, so they're not going anywhere else. Majority of the time, they can't commute anywhere else. So it's just a larger population to get your hands on and truly educate in Martin and Washington counties, and that's a project we continue to plan on doing. We don't plan to, obviously funds are something that is a big importance for this project, but we still have back in place and we're still planning on educating new moms on the importance of safe sleep, especially in all 3 counties.
And as I understand it, you've done a really good job in trying to reach the mothers where you can, correct? So even the dental clinics, can you talk a little bit more about that?
Yeah, so here at the health department, we're a 3-county district and we also have a dental clinic. So obviously, vice versa, anybody that's seen in the clinic is referred to dental. Anybody seen in dental potentially could be referred to our clinics. So they just try to really concentrate on anybody that would qualify for this program to make sure they're referred. The traffic has kind of decreased a little bit in both dental and in the clinic setting because of COVID. But our employees are well educated on safe sleep and they know exactly what to look for. Even our OBCN and pregnancy care managers, they may be dealing with a new mom or an expecting mom and ask them, what their current sleep environment sleep, which I think is very important. I have actually had several moms that are expecting twins. They didn't have anywhere for their child to sleep. They were just laying them on the bed or the floor or couch or things like that. So it does my heart good to know that they're getting a safe place for their newborns to sleep.
Yes, absolutely. And Pam, I agree with your comment there about the list of educational items and how those were understandable in terms of I reacted to the soda can too, and I wish I'd known that, but my kids were in the crib. What are your thoughts around, or rather, what have you done any community outreach, and if so, what does that look like, and or are you planning to do any outreach?
Our community outreach kind of did get halted a little bit because of COVID. We actually received the AMWOLF mini grant again this year, and we're still concentrating on infant mortality, but it's just going to not be as much as safe sleep, not because it's not important, just because we like to look at other areas. It's going to be involved with car seats and traffic safety and things like that. So we're hoping to be able to get multiple employees trained to be certified car seat technicians, and that way we can give out car seats and install car seats. And that way when we put our hands on more populations than just people here at the health department, we also, once certified, could hold the drive-through clinics where they could drive through. We can make sure their car seat's installed correctly or install it for them. And that still would be trying to minimize the percentage of infant mortality here in all 3 counties, and then of course across North Carolina. Actually, if you look at it, Terrell and Washington County currently does not have anybody certified to do the car seat. So it is extremely important to go ahead and get staff trained. That's also been put on hold because of COVID, but Lord willing, in 2021, we'll be able to send a good crew of people and go ahead and get them trained. That way we can also add that service and benefit those in the community that don't normally come to the health department.
So that's some great work. Some great work that can actually span to every other county in the states, really. So if anyone wants to hear more about how you would go about this, or pick people's brains about it, or Heather when she's back, or Kirsten's on maternity leave, so I don't know when she's going to be back. But please, again, access the project write-up and learn more about what exactly they did in the project, and also get in touch with them to collaborate and spread this work, which is so important. Nicole, thank you so much for your work. Thank you for the presentation. Thank you also to Heather and Kirsten that are not here today. Unfortunately, Heather is not feeling well. She's not well. She's on sick leave, and Kirsten, as I said, is on maternity leave. Also, congratulations on the grants. I'm really happy to hear that you received it again this year.
Yes, we are so excited.
Yeah.
Thank you.
Congratulations. Thank you so much. And this wraps up our final presentation in the Emerging Leaders in Public Health Leadership Development Program that we in the Medical Society are very, very proud of to do in partnership with North Carolina Public Health Association. Before all of you sign off, I just want to read out the names of the participants in this group. And for the participants, you will all receive for now, a virtual certificate, and then we will send you a certificate as well in the mail. So just be on the lookout for that. But with that, Aubrey and I, because Aubrey is in the audience and she is also equally involved in this program as my colleague and partner in crime. And we want to thank the following people for participating and for taking the time and putting the energy and efforts into this program, because, we co-create the program. So it's also as much about the participant as it is about the content. But we want to thank the following individuals and congratulate them on graduating from this program. Nicole Barnes, Martin Terrell, Washington District Health Department. Kirsten Beasley, Martin Terrell, Washington District Health Department. Heather Bradley, Transylvania Public Health. Summer Curry, Davidson County Health Department. Betty Foe, Cabarrus Health Alliance. Caitlin Franklin, Richmond Department of Health and Human Services. Tarika Fuller, Cumberland County Health Department. Dana Larnett, Appalachian District Health Department. Tony Locklear, Hope County Health Department. Terry McNeil, Richmond Department of Health and Human Services. Kelly Ransdell, National Fire Protection Association. And Jamie Todd, Cleveland County Health Department. Thank you all so much. It's been a pleasure to pass a year with you. Thank you for and we hope that we will connect with you in some other forum soon again. And without any further ado, that wraps up our graduation, our project day presentation. And if I could, I would ask everybody to applaud this wonderful group of leaders that will change the world as we know it in terms of public health. Thank you all.
He's supposed to be doing his work, but there's a lot of things.
Sounds like you're having a blast. Oh, and everybody likes the idea of taking the 24,000 and buying hand sanitizer, mask, and bag on. It looks what I've done in here. I know. But I mean, that and a rack card that is a shot. I guess they should. I like some of the FAQs that come out do that. Hand sanitizer or wash your hands. Rat card with the 3 W's. Wash your hands, wait 6 feet, wear a mask.
Are we gonna put get the flu shot on the hand
Yes,
sanitizer?
I'll say get your flu shot. Feel safe, get your flu shot. And our permit probably get the COVID vaccine. When it's available, our address, and website, and for education. And flu symptoms, the flu, symptoms of COVID, I guess we have to back those.
Yeah. I'm gonna email her and make sure, because then we'll have to answer those questions.
And then the reason I wash your hands. Wear a mask.
You said it's not necessary. I love preparedness as far as the planning, but I don't like how they make personal things with the money that you just store indefinitely.
And that's what I told it, if we throw it away, I just told George how to keep it, so they come and say, what you do with this, and you don't, $19.99, you know, or whatever.
It's expired, we got rid of it, or
And we're gonna say it was obsolete, you couldn't use it, so I keep.
throw it away. Yep. No, I agree.
If you had it at the end with school nurse, with that card,